DocSwiner. Come on in. Surprise. This is a surprise medical minutes. I've owed you this for weeks. But now I finally had the time to just jump in. I was awake for the most part and up and doing things. I just did one of my hydration wellness clients, so I figured I'm up. I got clothes on. My hair is done. Let's get on. Welcome. Happy Monday. Happy St. Patty's Day. I got a little hint of green on, so don't get painted. Don't get painted today on St. Patrick's Day. All right. So if this is your first time tuning in on an Instagram Live, I am Dr. Nicole Swiner, otherwise known as DocSwiner. I am a family medicine physician, entrepreneur, media and news, guest when it comes to medical things. Hey, I see folks signing in. Welcome. Good morning. And I do this thing called Medical Minutes every once in a while that focuses on the topics that I love to talk about. Your bread and butter family medicine things, chronic disease, preventative disease, mental health, pediatrics, women's health, all the stuff that family medicine is made up of, and like trending topics when it comes to things that we need to be advised on, know about, be proactive about. And so during the pandemic, good morning, Soror, I see you. During the pandemic, I talked a lot about COVID and the ways that we can prevent COVID and vaccination and treatment, all that good stuff. Now with even more stuff popping up and, things to worry about with the changing of the tides and the administration, etc., figured I would come on and talk a little bit about COVID too, but more specifically MMR and the other stuff to think about. There's always something to think about, worry about, try to prevent, from catching and then spreading to your family and community. So I try to stay on top of it so that I can tell y'all and we can all stay on top of it. So ask your questions if you have them. I'm of course going to save this and put this on my in my reels so you can have it to rewatch or listen to or share with others. As a disclaimer, always talk to your primary care providers. Always have a good rapport and good relationship, open communication with them, so that when you find things that are interesting or concerning or you're worried about, you can always then check in with them and you all can come up with an action plan together, okay? So let's start with MMR, measles, mumps, rubella, right? This is on everybody's timeline and everybody's list of things to think about and learn about. And I hope y'all can hear me okay. I should have worn my mic, but I hope y'all can hear me okay. I'll take this off so it doesn't jingle. MMR, measles, mumps, and rubella, unfortunately, has become something that we've had to worry about recently when for decades we didn't have to think about or worry about because we were doing a good job with getting vaccinated. Now with the increase of those that are not either not getting vaccinated because it's their personal choice or because of unfortunate misinformation that's out there in the medical world and being, circulated in the media and through social media, a lot of folks are concerned about getting MMR vaccinations. And just because things happen, there are trends in the medical field where for a while, things are dormant and don't really cause problems, and then all of a sudden it spikes or peaks. And that's what's happening now with MMR or measles, mumps, and rubella infections. So if you were born, and this is taken from a lot of the medical literature that I follow, particularly the CDC, which, by the way, unfortunately, again, with the current administration and changes, a lot of things are being taken off the cdc.gov website, which is what a lot of us in the medical world use as our standard and guidance. A lot of that stuff is being removed. A lot of grant funding is being removed for research. So God bless us. But what I and a lot of my fellow colleagues are trying to do is gather up that information so that we can have it somewhere, we can safeguard it, we can keep it so that we have it when we need it for stuff like this. So I digress. But anyway, MMR is coming back. It has made a comeback. I've had family members in Maryland share stories. Texas has been hit hard. I think one case already has hit North Carolina. So the number one prevention, and I know people hate to hear this, is vaccination. We had wonderful research and researchers centuries ago, right? come up with these good, not centuries, decades, come up with these wonderful guidelines, these wonderful things that were life-saving when MMR first became a huge issue, and started to vaccinate people, and we decreased the incidence of those diseases tremendously, like polio, right? That's another one that popped up again within the last couple of years. But in general, most of us, thankfully, particularly in my age group, if you were born after 1957, have been vaccinated, right? So as kids, generally when you were 12 months of age, and then again right before going to school at 4 to 6 years old, we got our 2 vaccinations. So we are good. If you're born after 1957, you should be in that category of people that got 2 vaccinations, and you should be immune. If you were born before 1957, you should also be immune, is what the CDC is saying, because of, who knows, whether it was community transmission at that point or just the immunity numbers at that point during that era allowed you to be immune, and they may have gotten vaccinated as well. But the current guidelines state if you were born before 1957, you're good. If you were born after 1957 till about now, you likely got those 2 vaccinations, the 2 MMRs, between ages 1 and then again at 4 to 6 years old, and you're good. If you have any question about that, or you got the infection and you're good, right? So you got the infection, you got natural antibodies, and you're immune, and you're fine. If there's any question about, did I get my 2 doses? Did my, immunity run out? I got mine in 1958. Does that still mean I'm immune? If you have any questions or concern about that, you can always check in with your primary care, because it's not really being encouraged widely for everybody to run to the lab and get their titers or their antibodies checked, but it is available. So if you go and you talk to your primary care provider, you don't have your vaccination records and you're not sure whether you got that second booster or those doses at all, they can check in your lab work and check your titers, check your antibodies. Now, they're also saying if you check your antibodies or your titers in the lab, it doesn't necessarily mean you're not immune, right? So usually we check your antibodies are positive, your IgG, and we say, great, you're good. You've either had the disease and you have the natural immunity, or your vaccinations are still there, you're good. Unfortunately for the MMR titers, even if they're negative, it doesn't mean you're not good. Does that make sense? So there's been this whole controversy about, well, should we check them anyway, right? My rule of thumb is, if it keeps you up at night and checking your blood work is going to make you feel better, then by all means go and get your blood work checked, right? Check your titers, have a discussion with your primary care and say, hey, okay, so these are the results of the labs. Does that mean I should get a booster shot or not? If you can't sleep at night and you check your titers and you've done all that work and you still can't sleep at night, by all means, just get a booster. And I may actually get a booster, particularly if we start seeing the numbers rise in North Carolina. Even though I am pretty sure I've had 2 doses, I know my children definitely had, I may check my titers. I may just go to some place like, my favorite place is South Point Pharmacy. You can make an appointment online, and they have almost all the types of vaccines that you need. Take your insurance card, get your shot, and you're good to go. So I may go ahead. I'm going to, kind of pay attention to the trends. I think I'm good for now because it's not, a huge issue right now in North Carolina, but if the numbers start to increase, I may just go ahead and get a booster, particularly since I'm in the healthcare field. I may be around a lot of other sick, potentially sick people. My kids are good because I know I got their vaccinations at age 1 and then again before school at 4 to 6. May talk to my husband as well and see if he's able to check his vaccination records. If not, I may just go ahead and booster him too, because there's no time to get sick, right? We have other stuff to worry about. Measles, mumps, and rubella, I'm sure you've seen all the, horrible pictures, but it starts out as, actually, measles, mumps, and rubella, by the way, there were 3 different viruses put together. But they tend to kind of happen together. Measles is the primary one. Start out as a respiratory infection. So even more confusing now. We got to add this into the list of, is it a cold? Is it allergies? Is it COVID? Is it flu? Because they all pretty much start the same. Runny nose, throat, sneezing, coughing, right? The usual stuff. But then maybe 2 or 3 days later, the classic rash pops up, and you've seen pictures, I'm sure, on social media. The rash is kind of a red splotchy rash, and it starts from head and goes all the way down to toe, particularly on the palms of the hands and on the face. You'll probably see those pictures. But the rash doesn't happen until later. People start getting sick with the usual respiratory symptoms first, and then the rash happens. I had to remind myself, I was wondering, once people get the rash, is the rash itself the way that it's spread? And it's not. It's from the respiratory stuff. So that leads me to remind everybody that almost all these infections we're talking about, with the exception of norovirus, which we'll talk about next, all of these infections are spread through the respiratory system. So people coughing, people breathing on you that have the infections, sneeze and leave the area and you walk into it. That's how these infections are spread. So wearing your mask, again, just like it was for COVID, you might want to reconsider, especially if you're on planes, especially if you're in a large area with unfamiliar people, meaning people that you don't normally spend time with. You may want to take your mask and put your mask on. Since COVID happened, I never stopped wearing my mask in the airport. Never stopped wearing my mask on the plane. Never. Depending on my comfort, I would wear, maybe less masks. When at the height of COVID, I was wearing 2 masks on top of one another. Now I'm down to 1. I might go back to 2, or my N95, which is like the hospital grade mask, just because it's just too much happening out here. So, all right. So I hope I kind of explained a little bit about MMR. So check your vaccination status. Talk to your primary care about it. If you're worried, get the booster. Really, there are very minimal side effects, despite some of the misinformation that's online. I may go ahead and get a booster shot, particularly if the numbers start to increase. If the numbers are high in your area, you may just want to consider either getting your titers checked or just getting the booster shot, depending on your comfort level. The treatment, by the way, it's a virus, so antibiotics do not work. So do not call your physician and ask them for some antibiotics, because that will not work. It's a virus, so they have immune globulins or immunoglobulins that you can get like through an injection or infusion. Of course, rest, Tylenol, hydration, all the usual stuff you do for a respiratory virus. That's the treatment. The best way to not get it is to prevent it, and that is through vaccination. Okay? All right, let's skip around to norovirus real quick. Hey, everybody, I see y'all. Let me know if you have any questions. Norovirus is a stomach flu, right? So, a GI bug that can cause nausea, vomiting, diarrhea. That is something that has been popping up in the media as well, or in the community as well, particularly for kids, just because they're just touching and sharing things all the time. But norovirus affects the stomach. It's one of the big and bad GI bugs or stomach flus that you'll see. There is no vaccination for that, so you just have to be careful. It is spread through what we call fecal oral transmission, which is exactly what it sounds like. So someone has left remnants and residue somewhere, and you touch the surface, and then you go to eat your meal, and now it's in your mouth. That's horrible. But yes, that's what it is. Fecal oral transmission is how these GI bugs spread. And that's what norovirus is. There's no vaccination or prevention for it. You just have to wash your hands. Try not to be touching people and touch your face, touch your mouth. Make sure, you're hygienic and cleaning yourself well. Make sure your bathrooms, places that you use the bathroom, are very clean, and that you're trying to be as careful as possible. For any and all of these, of course, the healthier you are, the better, right? So trying to stay as healthy as possible, taking all your multivitamins or getting those through your diet as much as possible, definitely keeps you as healthy as you can, so that even if you are exposed to these things, hopefully you won't catch them. Or if you do catch them, you won't be sick for as long as everyone else, right? So taking your vitamins, making sure you're getting things like vitamin A, vitamin E. Those are great anti-inflammatories and antioxidants for your body. Immune boosters. Vitamin B complex, all the vitamin Bs, zinc, right? Hey, Miss Stephanie. What else? Did I say vitamin C? ACE, vitamin B complex, zinc. I know a lot of my folks in my community take sea moss. It's also supposed to be a very good immune booster. Staying hydrated, water, 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 flushing those kidneys, keeping you as healthy, getting good sleep. The healthier you are in general, the less that you will get sick. And then even if you do get exposed and catch one of these infections, hopefully the shorter the time that you'll be sick and the less intense those infections will be. Okay, so we talked about MMR already. Norovirus is a GI bug. Making sure you're washing your hands and not sharing a bunch of fecal oral things with people. Take that however you want. There's no vaccine. Rotavirus, you may have heard of, is another GI bug. It does have a vaccination, and it's usually for babies. So usually around the ages of like 2, 4, and 6 months, babies are getting the oral vaccine for rotavirus. So that is good and that is protective. If you want to talk to your physician or your providers about getting vaccinated for rotavirus, that's one thing. But norovirus, there's not one yet. It's in research. Stephanie is asking, is magnesium good for immunity? Yeah, it's so-so. Magnesium we use for a lot of different purposes. There are a lot of different versions of magnesium. So, for instance, magnesium glycinate is great for sleep. Magnesium, forgive me if I'm getting wrong, magnesium sulfate and gluconate are good for muscle relaxation. And then magnesium oxide, like milk of magnesia over the counter, that's good for your gut. So there are different types of magnesiums for different types of things. Immunity, it's not necessarily the ones I think of primarily for your immune system, but it's good. It's good to take. COVID and flu, still around. Flu season lasts sometimes until April or May. If you've not gotten your flu shot, I would still encourage you to get it because there are still a couple of months, worth of the flu season that is still going on. Clearly, COVID is still an issue. I hate to say I've been reading things about other versions of COVID that are now showing up in other countries. God bless us. Mm-hmm. With the research question going on, meaning there's less funding now being allowed for research, particularly for vaccinations. Will we have an adequate flu shot this coming season? Will we have free COVID vaccines for people that really need them? We don't know, right? So if you haven't already gotten vaccinated and you want to get vaccinated, hurry up and get vaccinated, because my plan was to every year when it's time for my flu shot, which is generally in the fall, in October-ish sometime, like before homecoming season, I'm usually getting all my shots. So I'm getting a flu shot updated, getting my COVID booster. Hopefully we'll still have those available. Hopefully they'll be the updated versions of the ones that we need. And we can all stay, from getting sick. Again, prevention-wise, wearing your mask in unfamiliar large group settings is always a good idea. Having your sanitizer on you at all times. My husband carries a spray in his pocket. I carry a little miniature one in my bag. My kids have them in their school bags. As soon as we get home from large group settings, we take a shower, we change our clothes, like we're not playing about it, right? Taking your vitamins or making sure you're getting them in your diet and your intake every day. Extremely important. Decreasing your stress, increasing your sleep, all that is. Two more things I want to mention. Pneumococcal and Tdap for whooping cough. Pneumococcal are the vaccine for the pneumonia bacteria, strep pneumonia particularly. The ages have changed recently. Usually we would wait and talk to people older than age 65, because pneumonia can be a huge cause of hospitalization and fatalities for the elderly population. So we were vaccinating people at age 65. And then we moved it back to 50, particularly for those who have illnesses that put them at high risk, diabetes and other things that lower your immune system. For the majority of adults now, I think we are moving to age 50. So if you have not gotten your pneumonia or your Pneumovax vaccine, and that's something that you want to get to prevent pneumonias, which is rampant now in the community, particularly walking pneumonia, then you may want to talk to your primary care about that too, or call your pharmacies, which can also check your health history, see if you need a vaccine. They give you the vaccine as well with insurance. A lot of these may, at some point, also no longer be covered by insurance. It's another thing that's happening with this current administration. So people that can't afford their medicines and vaccines, it's going to be a problem for them. But I would go ahead and try it now if that's something that you want. Lastly, I'll mention Tdap, which is your tetanus, your pertussis. Tdap with a P on the end is for pertussis, which is whooping cough. There have been a lot of people with, quote, walking pneumonia that may have thought they had kind of atypical viral pneumonia, but it actually was pertussis causing whooping cough. I think I may have had this, when was this? After homecoming time, so October, we were out and about with a bunch of people. I think the last time I'd gotten a tetanus vaccine, which now includes the P on the end, Tdap, was pregnancy. So that was more than 10 years ago. And the Tdap one tetanus isn't one you often think about because we're so focused on like COVID and flu and getting these other shots and staying up to date. But I went for my physical and my primary told me, yes, you're going to need your Tdap. Come back and get that when you can because I think I got my flu shot that day, so I wanted to wait. So after homecoming, everybody gets a little bit of sniffle cold, came back home, and the cough just would not go away. I think I had like hoarseness and sore throat for like weeks. And I was like, you know what? I might have that whooping cough. Let me go and get checked. Went in to get checked, listened to my lungs. They were, scraggly and crackly. So I got an antibiotic and felt better. I was like, you know what? I bet you that was a little bit of whooping cough because I started hearing about that popping up in the community again. So I went shortly thereafter and got my tetanus shot, Tdap, and that should last me for 10 years. So it's out there. Y'all be careful. Fluids, sleep, decreasing your stress, taking your vitamins. Y'all know I talk about black girl vitamins all the time, but getting just some sort of multivitamin that has your A, C, E, vitamin B complex, zinc. Those are the big ones for immune system. Your CMOS for your immune system. Make sure you're taking these things. Make sure if you're not taking a supplement that you're getting those things in your diet through your fruits and your vegetables and all of that. Yes, elderberry is great. I took elderberry in the peak of COVID time because I heard specifically about elderberry and helping to prevent COVID and flu. So I did take elderberry for a long time during that period. All right. Okay. I think that's enough of the word vomit. I'll let y'all soak that in and meditate on that. I'm going to post this on my timeline so that you have it. You can come back and ask questions if you have them. I'll try to answer them as well. Share it with your folks. For my folks that get vaccines, do not be dismayed. Do not follow misinformation. I know it's hard now because, again, information that we have worked hard on and done a lot of research on now is being removed from websites. Grant funding is being removed from research. You're going to need those medical folks that you really care for and trust and that have sense. You need to be with people and you need to have people taking care of you that talk sense and make sense. So just, use your common sense. Use your intuition. Stay with those folks that you trust because you're going to need them to answer those hard questions, okay? All right, guys. Y'all be safe, and I will see y'all soon. Take care. Bye. Hey, everybody. It's DocSwiner. Come on in. Surprise. This is a surprise medical minutes. I've owed you this for weeks.